turn to our guest in the room. And Mr. Hashmi, would you please present to us?
Thank you very much, sir. Good evening, everyone. My name is Sikander Hashmi, and I serve as an Imam at the Canada Muslim Association in Ottawa, and I'm also a member of the Council of Imams of Ottawa-Gatineau. This evening, I'm here with you as a spokesperson for the Canadian Council of Imams. In the Islamic faith tradition, neither euthanasia nor assisted suicide are supported or encouraged. However, since that matter has already been decided by the Supreme Court, our concerns regarding the legalization of physician-assisted dying center around the preservation and the sanctity of life, as well as the vulnerability of patients. Most Canadians would agree that life is sacred and an effort should be made in most, if not all circumstances, to preserve it. The Quran highlights the importance of saving a life in verse 532, quote, "Whoever saves a life, it is as if they have saved humanity entirely." We understand that in some cases, patients experiencing extreme levels of pain and suffering, and those expecting the same in the future, may desire an end to their life. We empathize with them, and as we draw from our faith, we are instructed to pray for them, to gain relief from their suffering, and to try our best to make them comfortable by providing the best possible care. Our concern is that the availability of the option to die with the assistance of another individual may, in some cases, be subject to the interests of others rather than the patient, leading to direct or indirect encouragement and promotion of physician-assisted dying. We believe that there must be robust safeguards in place to ensure that this option is exercised only by those who voluntarily and independently choose physician-assisted dying after going through an informed decision-making process. We propose that any such requests be considered and evaluated by an end-of-life team of 4 members. Firstly, a physician, ideally one who is familiar with the medical history of the patient and is involved in treating the patient. Secondly, a psychiatrist or psychologist who is able to understand the mental state of the patient and the reasons for their decision. Thirdly, a social worker who can inform the patient about care options available to them and discuss potential impacts of their choices upon themselves and on their family members. And finally, a spiritual care provider representing the faith tradition of the patient who can offer spiritual counsel and advice if the patient desires their services. This team shall ensure that all care options available to the patient have been clearly explained without bias, that the patient has made the decision voluntarily and without duress or encouragement from another party, that the patient understands the impact of their decision, and that the patient's immediate family members are informed, if possible, about this process and counseling is offered to them unless explicitly requested otherwise by the patient. Furthermore, we recommend that Section 241A of the Criminal Code of Canada be amended to ensure that encouragement to commit suicide, including physician-assisted death, remains a criminal offense. In our view, a patient should be able to seek the assistance of a physician to end their life only if they meet all of the following criteria. They're above the age of majority in their jurisdiction, they're capable of for personal care, they're suffering from grievous and irremediable medical condition, they're in an advanced state of irreversible decline in capability, and they experience regular and unbearable physical suffering, which cannot be relieved in a manner the patient deems tolerable. The patient should be required to sign a request form, or in the case of a disability, express their wish clearly in unambiguous terms through any other means. The process and procedures could be as follows: that the patient would inform the care provider of their request or of their desire for care or for physician-assisted death. The end-of-life care team would visit the patient to assess eligibility and inform them about available choices. The team would contact family members, inform them about the request, and offer them support unless requested otherwise by the patient. The team would make a follow-up visit to the patient, and if the patient chooses physician-assisted dying, the team would have them sign appropriate forms. The request would be submitted to the healthcare provider. The healthcare provider would arrange for the time, location, and physician who is willing to assist the patient in dying. Details of this would be shared with immediate family members, unless requested otherwise by the patient. Before the procedure, the end-of-life care team would once again confirm the decision with the patient if the patient is still able to communicate. If the response is in the affirmative, the physician would assist the patient in ending their life, and the death would be reported to a central federal registry. Physicians and faith-based care facilities should not be compelled, in our view, to perform this procedure if their conscience, faith, and personal values do not allow for the taking of life. We would like to highlight the College of Family Physicians of Canada's statement on issues related to end-of-life care, which states, quote, "As a matter of social justice, all Canadians should have access to palliative care that meets national standards. Palliative care must be available in all healthcare settings. In addition, a variety of settings must be available for end-of-life care." We also echo their call for sufficient funding to ensure that all Canadians have access to palliative care that meets national standards and the needs of each community. The teachings of our faith lead us to believe that every disease has a cure. We just have to work to find it. Therefore, we recommend placing a greater emphasis on medical research towards finding cures and better pain management methods, particularly through increased funding and reversal of cuts to programs such as the combined MD-PhD programs for which funding was withdrawn in June of 2015. In conclusion, we would like to reiterate that neither euthanasia nor assisted suicide are supported or encouraged in the Islamic faith tradition. We believe there is a need and an opportunity to improve quality of life for patients and to protect the vulnerable. We hope our suggestions are useful in developing legislation that is balanced and compassionate. Thank you very much.
Thank you very much. Now, committee members, we have three panels, so would you be very clear in who you're directing your question to? Mr. Arsenault.
First, yes, I'd like to ask my question to Dr. Davis about age, concernant l'âge des enfants mineurs.
Concerning the age of minors, I'll be very brief. How can you determine